very much. Good morning, dear colleagues. It's my pleasure to be here with you. The motivator of our success is the World Federation of Hemophilia. It is a great support from the Ministry of Health and the green light from the hospital administration. That's what this program aims to achieve. I would like to thank the organizers for this opportunity and will present to you the latest treatment approaches in Armenia and our experience. We present to you the distribution of patients by gender. By the way, immune hemophilia is common in our country. As we know, the number of hemophilia in the world is 430,000, according to WFH Annual Global Report 2021. We present to you the incidence rate in the last 12 years. The purple color is a boy. The red line is a woman. Women with Willebrand diseases, women with immune hemophilia are also included here. The total number of patients is highlighted in blue. In my opinion, we have a problem with Willebrand's discoverability. As you can see, the majority of patients are hemophilia A patients. 54 of the total patients are young patients under the 18 years of age. We are able to cover their treatment and we have a home prophylactic treatment therapy. New good news in the last year. Families have a big role to play in preventing the spread. They are trying to apply for IVF fertilization to predict the gender. By the way, it is available here. The majority are 30 to 39 years old and 10 to 19 years old. Let me explain and clarify now what the problem is. There is a mentality in Armenia to hide the hereditary diseases. It hinders the work of doctors. Therefore, the group of 10 to 19 years old has the opportunity to be screened at the pre-conscription or pre-military or military age. It is also, why not, an opportunity to avoid of military service. We cannot estimate why the prevalence is higher in the Lori region. I guess it is related to birth. The birth rate in Armenia, according to regions, is higher in Lori. About treatment. As you see here, all types of therapies are available in Armenia, except gene therapy. As I mentioned it, we have home prophylactic therapy. We use low-dose home therapy model, 10 to 15 international units per kilogram every 2 or 3 weeks per week. Armenia is one of the countries who approved and adopt Emicizumab program. Some of modern techniques like plasma factors or recombinant factors, Elocta, are also in use for the treatment of hemophilia in Armenia. Here are the figures. Our strategic priorities: improve outreach and diagnosis of people with bleeding disorders, increase access to adequate and affordable care. We can claim success when all patients with bleeding disorders have been identified and have access to adequate care. We started this program in 2021 December, and we started with 32 patients, and now we have 46 patients on Emicizumab. We are using the modern guidelines from WFH. We use loading dose and maintenance dose. As mentioned here, children are happy to get an injection once a month. Edemas and redness in about 1.5 of patients. It was reported after the first and second injection and subsequently passed. There were 3 cases of repeated bleeding or recidives. During the treatment of Emicizumab, as I have already told you, we met such cases like redness at the site of the injection. Some of our patients were taught to make injections themselves. Dosage calculated by doctor after checking body mass before each injection. Here is where Emicizumab and factors is kept. Also, examples of paper database of patients. We have also electronic database. Different products have their own refrigerator with a special temperature and registration log. Different diagnoses are fixed in folders with different colors. During the treatment with Emicizumab, we had 3 cases of hemarthrosis. I will try to show 2 cases. First case is an ankle hemarthrosis, which was complicated and needed surgical intervention. The second case of knee hemarthrosis, 60 years old. We have the ability to do all these researches, all these tests, APTT, one-stage APTT-based, Bethesda assays, inhibitors assays, mixed test. Emicizumab donation program, we adapted from WFH, innovative, approved, and highly effective treatment for the most patient group. In most cases, 0 bleeding in patient and increase of patient quality of life. Why is this method of treatment suitable or convenient? Because of subcutaneous injection, convenient treatment, higher adherence, reduction of disability, especially in pediatric population, and reduction of repeated hospitalizations. I have decided to end my speech with Charles now. Thank you for your attention.